And welcome back to another awesome episode of Built to Endure with me, Dr. Danny Shapiro, Dr. Physical Therapy. Today we have an incredible, awesome guest. I'm a big fan of her. She's absolutely awesome. Dr. Roni Glassman, Dr. Physical Therapy as well. Take it away. Tell us about you. Tell us what you do, what you specialize in, all that good stuff.
Thanks for the amazing intro, Danny. Thanks for having me on. Yep, my name is Roni, and I live in Chattanooga, Tennessee. I'm originally from Atlanta, and I, like you, am a physical therapist. I have not been practicing quite as long, but I did open up my own practice about a year and a half ago in downtown Chattanooga. And I like to say that I treat the weekend warriors of Chattanooga. So I see a lot of active adults, mostly people between the ages of like 35 to 55, even 60. And I love what I do. Most people that I see are like runners, weightlifters, triathletes, or just people that are personal training and trying to get back into the gym and are limited in some capacity. And if I'm not doing that, I am hosting my podcast as well, the Rehab with Roni podcast. I'm creating content online. And I also just had a baby not too long ago. So learning how to navigate that as well.
Wow, just a master of all trades.
I'm trying.
I love that. So that's awesome. I love the population that you treat. That's great. Out of curiosity, what actually prompted you to open up your own clinic? What was that driving decision to do that?
Yes, it was an evolution of small decisions that like culminated into one big shift. I really never planned on having my own practice. Unlike you, I out of school was like, let me just work my good 9 to 5 job and be comfortable with it and get my PTO and just live my life. And it wasn't until I was working in the outpatient world for about 2 years that I realized I don't think I like this anymore. And so I started to see people on the side in a private personal training gym. And that just sort of evolved into like, wow, I think I could make this work. I think people would pay for my services and I wouldn't even have to go to my full-time job. Maybe let me just try and do both at the same time. And then when I started really posting on social media, informing the masses of what I was doing and how I was making it work for myself, then my job caught on and they were like, "Hey, you have to actually you have to make a decision. You can't do both."
Mhm.
So, I just bet on myself last April and decided to go full-blown rehab with Ronnie, and that's how we are here today.
Amazing.
Yeah.
And you also have a PT now working for you as well, right?
Yes. Yep. I hired her beginning of the summer because I was at a crossroads. I didn't know with me being pregnant if I should just like close shop and see what the caseload looks like and what the demand is for me in 12, 16 weeks postpartum. But honestly, things were going so well. I just thought, why the hell not? So I put out a feeler to just see with the online following that I had, there might be a good chance that I could find somebody to take over my leave, and that's how I found my employee, actually. She was, like, the first person to apply, and she's just an absolute rock star, and so she was originally just hired for contract work just to work until I was ready to come back, but we've recently had some discussions about keeping her on, so she's gonna stay hanging out for the foreseeable future, which is exciting.
Yeah, that's always very exciting when people start to join your team, and especially people who you have a shared vision with, right? Because there's since you opened up your own clinic, and I do have a follow-up question to that in a second. You have a vision for how you want your clinic to be, how you want it to operate, right? There's certain values and certain standards that you want to hold true. If anyone's going to come through your doors, right, whether they're working with you or any PT with you, like you want the same values and standards of care, right?
Yes.
So it's really awesome when you come across another PT that you bring onto your team that has those same awesome values and standards of care.
Yeah. It really felt like the universe was aligning when I found her because and we talked about this a little bit on my podcast. It is hard to find the right person. Maybe not necessarily hard to find a good physical therapist, but hard to find one that maybe fits the bill in terms of just your standard of practice, kind of your beliefs, your mottos, all of the things that come with your company. And she really just like 110% was exactly what I wanted. And her onboarding phase was 6 weeks of us working together. And there were so many times where I would be about to tell a patient something and she would say the words that were on the tip of my tongue. And that's how I knew it was just the best fit because she didn't necessarily have to be my carbon copy, but the fact that I knew we were thinking along the same lines in terms of treatment and even just how we treat people was just awesome. I feel so lucky to have found her.
Yeah, I mean, and for that to be the first PT that you interviewed, I mean,
I
that's
know.
That is special.
I
That is
know.
very special.
I literally, my husband was in the interview too, because he's technically my business partner. And after she left, I told him, I said, I have no notes. Like, she's the one that I'm hiring. And he said, no, you have all these other people lined up. At least see them through. And I did, but I knew. I was like, nope, that's the one.
I don't know. Maybe it's something in the water in Tennessee, but I gotta tell you, at least from my end, it was very hard, and still is hard to find. First of all, just not even like you said, it's not even about being a carbon copy of me, but a good PT is very hard to find.
Mm-hmm.
Like communication aside, like, which is incredibly important, but even just to find an adequate, good quality PT who can stand on their own 2 feet and treat is actually very difficult here, which is kind of
Yeah.
crazy considering how many PTs there are in New York City. I've had people who came in who've had clinics of their own before, who just wanted to stop doing it and just become kind of like live the employee life, just have some stability. And it was horrible.
Really? Well, what do you
Horrible.
think defines a good PT? Because for me, what I was looking for was, one, just don't be weird. Like, I need you to be sociable, because it's a
Yeah,
one-on-one setting. So we're an hour with this one patient all day long. We are
exactly.
just having hour-long appointments, always one-on-one. So you have to be able to keep the flow going, be the social person if they're not. And then secondly, I like them to be a continuous learner. And I just knew that that's how she operates. Like, we are sending each other Instagram videos back and forth. Like, I think this for this patient. I think we should try this for this one. And it's the continuous being able to evolve and think differently and look at someone and think, maybe I was wrong about their diagnosis and we need to reconnect and look at them from a different angle. That's what I love about her and what I want to see in people that I hire. I'm curious what you think.
Yeah. I mean, that for sure. That needs to happen, and that doesn't often happen. Uh, a lot of the PTs that I've interviewed, it's the standard, a patient comes in with low back pain. Here are the standard 5 moves, and I actually hold during my interview process. It's like about 2 hours long.
Whoa.
If you make it to that step in the interview process, it's about 2 hours long. And as part of the interview process, I actually have a kind of like a clinical test where I'll give you a case that I've treated from start to finish. I know every detail. I will literally present as that case when they first presented to me. And
Hmm.
I'm not looking for perfection. I'm just looking for originality and thought process to, okay, like, what do you maybe think the diagnosis is? You can do the testing and I'll tell you what's positive, what's not. And then also, what would you prescribe me for a whole movement plan based on the symptoms I've described to you, based on the findings of the tests? And it's a standard nonsense that you typically get when you walk into your typical PT clinic. And I say, okay, these 5 moves that you gave me, they don't work. Give me 3 more. They give me 1 more. Like, I don't know anymore. I'm like, okay, there's the door. If
I
all
feel
you
like
got
I would be
is,
so scared in your interview. I'd be like, I don't know. I forgot all my things that I know.
well, no, Roddy, let's be real. You'd be perfect. You'd be awesome.
Yeah. But I think that's a good standard to have. Like, if you're interviewing somebody, it's a real case scenario that they would encounter and they need to be able to think through it. Still a little intimidating in an interview, but I think I did something similar.
I mean, we don't have time to mess around, right? First of all, it's our brand,
True.
it's our name, right? So if we're gonna have someone bring on our team, it's a hefty investment from our side. So we want it to actually to work, right? We want patients to love the people we bring on. We want the PT that we bring on to do the work that they need to do to get the person better. So they have to be, top-notch quality. And the reason I do this now during the interview process is because I made a pretty expensive investment into a PT, and I realized very quickly I need to fire that PT ASAP. Because they BS their way through the interview, and I was like, oh, cool, sounds good. And then when it came down to performance, I was like, oh my god, this is horrible,
Mm,
horrible. Patients
that's
didn't want to work
unfortunate.
with them. It was bad. It was really bad.
Yeah, I think the biggest thing that I don't even want to say nervous about, but I just wanted to make sure was set in place was a level of comfortability with the transition, because
Yeah,
it was just me from April of last year until August of this year. So people like Rehab with Roni, you go see Roni.
yeah.
And then now, who is this other person coming in the door? It was just, I was so adamant about the fact that she needed to be a certain type of, not a certain type of way, but like just even just the mannerisms and the way that she treats people needs to be a nice, solid transition where people feel like they're getting the exact same quality of care. And so when you think you have that and then you don't have that, that's tough.
Yeah, painful.
Yeah. I hope I don't ever
Painful.
experience that, but I'm sure I will.
I feel like everyone usually does, like,
Yeah,
because you again, I think you got lucky, which is awesome. That's an awesome thing to get lucky with,
I
and
know.
you take every ounce of luck you can. But at some point, as you grow and expand, like as you bring more team members on, whether it's for PT or other positions within your practice, you're gonna see like, okay, like that was a bad fit or this is a bad fit. You just get like a better gauge for it, which is all part of the fun processes of being a practice owner. It's a lot of work. It's a lot of work from our side, from not
Yeah,
only treatment but administrative stuff as well.
but that's
Uh,
fun. You get to learn as you go.
yeah, oh yeah. And speaking of which, I wanted to ask you this. I think this is going to be a really important question. So you said that the reason why you opened up your own practice is because you were getting tired of like the PT employee side of things,
Hmm.
right? Why? What got you? What was the thing that was like, all right, enough?
Oh, well, I'd say number one would just be feeling like I don't have control over the time in my life. And it's so cliche, but you only get one life to live. And I really felt like the majority of my time was spent doing something I didn't really want to do, which sounded backwards because obviously I went to school for 7 years, got my doctorate. I knew what I was getting myself into, but I just don't think I had grasped the concept of a full time job being so full time and not really getting the time to myself that I wanted to explore things that I wanted to do. That was probably the main thing. I think a lot of people leave the outpatient corporate world because they're just burnt out. And I could feel the beginnings of burnout starting to happen, but it was the it was really just not having ownership over my time. That was like I am realizing in my as I get older, I just am more of a free bird. Like I don't want someone to tell me what to do. And like if you work for a corporation, that's what your job is people telling you what to do. And then, I mean, we could go down the rabbit hole of seeing 2, 3 patients at a time, productivity standards, insurance reimbursement, and documentation things that you have to do, all the other things that come with working in that type of setting. But I think overarchingly, it was just let me get my time back.
So do you feel like you got your time back? Do you feel like you are like the day is your own?
Oh, 100%. And I got this question recently like, aren't you working so much more? And yes, of course, because there's so many facets to the business. Like you're saying, there's the administrative side, there's the content creation, patient care, caring for your employees, all the other things, but it's way more fun. And it's also on my time. So I can wake up and say, okay, I'm going to do this, this, and this today. These are my objectives, but I'm also going to squeeze a workout in and I'm going to hang out with my little baby. And I'm also going to, I don't know, go for a run. I don't know. Just do whatever I want to do. Like practice watercolor painting, whatever I want.
Do you practice watercolor painting?
I don't, but I might. Who knows?
That's it. After this podcast, that's the first
Yeah,
thing you're gonna
I'm
do.
purchasing
YouTube.
a set. Yes.
There you go. Amazing. I mean that's very like what you just said. It really is important making sure that you have the time to your own, and you're building something that's yours. You're not building it for someone else. Especially within, I rag on all the time the whole like 2, 3, 4 patient at a time model because it truly is it doesn't exemplify what PT is supposed to be.
Right.
Right, and the PTs working in that kind of setting, I mean, like you said, you feel the burnout coming on, and you're exhausted. You've just seen 25 patients in one day, and you're just kind of like, it's exhausting. It's exhausting. That's not what we went through a doctorate program to. That's not what we were designed to do here.
Right. Yes, it's profitable for the companies. And as reimbursement rates continue to decline, naturally, the demand is just going to be more. You're going to have to continue to double and triple yourself. But it sucks. I always think about what if you were going to see your primary care and they were like,
Hmm.
hey, there's 2 people sitting like you're sitting across from somebody and they're talking to you at the same time. Obviously, it's a little bit different. You can't really compare the 2, but it's a bummer. It's a bummer when that is kind of the standard of care. So
Yeah.
I'm glad to have been able to get out of it and provide good quality care and show people in Chattanooga this is what physical therapy can be. And I was thinking this too. One benefit of owning your own business and hiring somebody that I wasn't necessarily expecting is the opportunity to provide a really good career for somebody else. Because I was talking
Hmm.
to my PT when we were having our lunch and we were talking about her staying on. she was saying, I can't picture myself going back and working in an outpatient clinic. Like, I literally can't even fathom having to do that. And that makes me really happy. I'm like, cool, you have a job that you like so much that you can't even look back. You're going to be like unemployable unless it's a scenario like this. So that's a positive feeling to know that I can show people what physical therapy can be, and also show physical therapists that they don't have to hate their lives.
Well, that's exactly it, right? I mean, that's from not only the PT side, but like when a patient experiences the one-on-one model, and when a PT experiences the one-on-one model, you can't go back.
Yeah.
It's like you've just discovered a gold mine of, oh my god, is this actually what life is? What life can be like?
Yeah. It's like
You,
seeing a new color.
yeah,
Then
it's
you
like, oh
can't
my god,
unsee it.
and it's beautiful.
Yeah.
Yeah, that's always something that I knew from my rotations. The moment I was going through my rotations and I was working on these inpatient, outpatient places, I was like, no shot.
Hmm.
This ain't it. This is not what we were busting our asses for. To be enslaved to this kind of system that like there's no shot.
See, I didn't have that kind of foresight. I literally thought, this sucks for me as a tech. It sucks for me as a student, but I'm sure when I am the physical therapist in charge of the plan of care, I'm going to feel a lot differently. And in a way I did. I mean, there was so many great moments in that clinic that I worked at, and I don't regret any of the experiences that I had, but I just don't think I realized how much I was going to dislike that setting so quickly, because I'd been exposed to it so many times. I don't know what I was thinking, it's just a little maybe naive of me, but we moved
Well,
on.
yeah, I mean, I think my view of healthcare came from my father, who is also in healthcare. So he's a podiatrist, and he's been in the game for a long time. And since I was a kid, I just remember him saying like, "Yeah, insurance companies suck. They don't care about us. They're getting paid less." At some point, he had to stop doing surgeries because it cost him more to buy the materials for the surgery than the insurance companies would pay for the actual surgery itself.
So sad. Yeah.
And he was awesome. Like he was really good, really like hospital. He would go to hospitals and like he would do surgeries in there and stuff like that. And he owns his own private practice. But ever since I was a kid, he was just like, yeah, the healthcare system suck. It's getting worse. It's continuing to get watered down.
Yeah.
Providers suck. Like, and so I was like, yeah, maybe. And then when I saw it for myself, I was like, oh, okay, yeah, this sucks. This is exactly what he was talking about.
Yes. The
So,
classic, you've been told it 100 times, but until you see it for yourself, there's just a part of you that doesn't quite believe it. And you just went straight out from school and opened your practice, right?
yeah, yeah, yeah,
That's
yeah.
so ballsy. I love that for you.
Yeah, I really accredit that too, because I went to PT school in Amsterdam, and I really accredit my ability to be able to do that, to just pass the board, like come back, pass the boards, and then open up my own clinic because of the experience that I got there,
Hmm.
which was really cool. Because on top of the 3 rotations that I had, I also was working with a sports company that put like as a student they would put you at different like sports clubs,
Yeah. Weren't you
and
traveling with the rugby team?
yeah, yeah, yeah,
Yeah.
yeah,
Yeah.
exactly. So I would travel with them all across the country as their only physical therapist as a student. So, you
No
get the
pressure.
yeah, no pressure. Um, I would call ambulances onto the field. There's one time my team's player, his sternum got subluxated 3 centimeters under his rib cage because he landed on someone's knee while being tackled from
Oh my
behind.
God.
Half his body went numb. And I had to deal with that situation. Another time, the trifecta injury in the knee, you get the medial meniscus tear, MCL sprain, ACL tear, like boom, right in the same time. And then again, you're the one that's picking up the pieces and then rehabbing those players afterwards.
So you're like the athletic trainer also.
Oh yeah, well that's all my basis. I loved the sports injuries, kind of like you. And then I transitioned to mostly chronic pain folks, which I like we spoke about on your podcast. I really really love, which is
Yeah.
my question next to you. What made you choose the athletic kind of like weekend warrior patient population? And I believe there's some active history in your past as well, right? Do share with the class.
Yes, indeed. Well, okay. First, let me clear up something. I do not love the athletic injuries per se. Like, if I were to have had that job working on the field, I probably would have passed out, because I remember
Mm.
when I was in undergrad at Georgia State, we had to take an athletic training class. And one day they're pulling up YouTube videos on the big screen. I'm sitting in there. It's like one of those stadium classrooms. and they start showing people's femurs snapping, people's
Oh
knees going the
yeah.
opposite way. You're like, "Ooh, yeah, I love that stuff." No,
Mm. Yum.
I was I don't think it hit me in that moment, but I was like, "Oh, wow, I'm not enjoying this." I got up to go to the bathroom and get some water because I was like, "Let me just take a break." Passed out in the hallway, woke up in
What?
someone's lap. Yeah.
Oh my gosh.
So anyways, I knew from there on out I was never gonna go into athletic training because I can't stomach it. In the acute phase, like, it's it's hour 0, like, this has just happened, count me out. I don't wanna look at it, I can't. But anyways, to answer your question, I do love, seeing these people weeks out or months out after recovery. And I think I got into the weekend warrior space for a couple reasons. One, I started going to a CrossFit gym and I just loved it, which was kind of funny because I do feel like there's this kind of weird back and forth relationship with PT and CrossFit. Like some PTs think it's dumb, some CrossFitters, I don't know. I think it can be a weird relationship, but I personally loved it. I had patients that were going there and I was like, these classes are so fun. They're kicking my ass. So I started to see more CrossFit type athletes in the clinic, which got me thinking, wow, I really like working just with weightlifters in general. So that was kind of where that came from. And then, I mean, I think, and we talked about this in my podcast, I've always had a love for just the arts, for dance. That's what I
Mhm.
did back when I was growing up. That was my main sport. But I don't really treat that many dancers. It's not a big dance community in Chattanooga. Probably not the same as it would be like in New York City.
Yeah.
But through starting with the CrossFitters and realizing how much I enjoyed just weight training, weightlifting, rehabbing those injuries, analyzing lifting form, all those things. That's really where I got started. And then the PT that I brought on, she's even more into like the running, marathons, half marathons, and rehabbing those people. And so that's kind of where our specialty lies.
Okay.
Yeah.
So I guess like of the patients that you see, is it primarily just those kinds of people? Is there any like outliers or anything like that?
I would say the general person that we see, because, well, when I first started, I was inside of a gym space and that I was getting a lot of CrossFit athletes. I would say probably 70% of my caseload was someone from CrossFit. And that
Oh
was super
wow.
fun, super fun.
Yeah.
And then as I transitioned into my own space, hired somebody on, and word got around town that like go see Ronnie for X, Y, and Z, it became less specific to CrossFit and weightlifting and more like this is an active adult who is having low back pain and they're going to personal training, but they're limited in what they can do at personal training. And it's affecting, you know, their ability to drive, it's affecting their ability to pick up their kids. That's probably more the niche now, but we will still get the extremes on both ends. So like we still have maybe somebody in their 60s who's having difficulty like walking, but they're still active. They're golfing a bunch. And then we still have, I mean, we had yesterday or 2 days ago, the owner of the CrossFit gym come in with like back pain. So
Awesome.
it's a pretty good range, which I like. I think I would get a little bit bored if it was the same type of person over and over again.
Yeah, fair enough. That's kind of reason why I love people who like work with people who have chronic pain so much is
Mhm.
because everyone is so different in their pain journey at that point. And
Right.
everyone wants to get back to being active again. They just don't know how.
Yes. Yeah. They
And
don't know
like
how to, the
that's
first steps.
yeah. And I
Yeah.
love that. Taking them through the first steps, the second steps, third steps, until the final step where they have that freedom again. That whole journey, and it's been like 8 years since they've been able to squat, and it's like, okay, we have a vision ahead of us. It's exciting. So
Yeah.
that's
And
yeah.
booking the physical therapy appointment is such a huge step for people. I think I try not to overlook that. I had someone call yesterday and I said, "Oh, I've heard your name before. I thought you might be calling us." And she said, "I'm finally making the call. I'm so excited to finally come in. I've been so busy, yada yada." And I think I try not to overlook that because that's a huge thing for people to call, get on the schedule, drive over, spend the hour and a half in the eval. I mean, it's a lot. It's a commitment for them. So I try to make it worth their time and educate as best I can.
And rightfully so, which is, I think, something that's really missing in the PT atmosphere. There's very little education. There's very little motivation. There's very little actual guidance of an actual plan that's tailored to that individual because of that two, three, four patients at a time model.
Yes.
Uh,
You
like
can
it
only do so
just
much.
exactly about
Yeah.
20 minutes worth of much,
Yeah.
if that,
Yeah.
you know.
Yeah. You're lucky.
Yeah, exactly. Which I mean, I kind of know the answer to this, but I really want to hear you say it because I rag on this all the time as well, like the whole two, three, four patient at a time model. Um, what is like again, you're cash pay, right? You're 100% cash pay,
Yep, I've never billed insurance. I don't plan to.
right? Not even out of network coverage.
Mm,
You
yeah,
do that?
that's true. So yeah, we'll do super bills and out of network coverage. Yes.
Okay, cool. Yeah, all right.
Yeah.
So same. What was, let's say, like t- the main reason that you went cash pay, and you did that from the beginning, right?
From the beginning. Yeah.
Love it. So what was the main reason that you went cash pay from the beginning?
I Well, that's a good question. I don't think anybody's ever asked me that. I think when I was still working at my big job, I say big job, my main job, my 40-hour a week job, I was getting paid. People were Venmoing me to come into my guest room upstairs and I would do some dry needling. Obviously, I had consent forms
Hmm.
and they were just sending me cash or paying me in cash or writing me a check. And I was like, well, this is very easy. This is very, I mean, there's no headache. I'm making money and I'm not having to deal with anything insurance wise. And I've had a fair amount of experience with insurance in the past because my job before PT school was a lot of verifying people's benefits, submitting
Hmm.
for approvals, all of these things. And I just thought, well, why even get into that space if people are already willing to come and pay me just regular cash money? So I just genuinely didn't even entertain it because I just knew where the insurance world was going, how much of a headache it would be just administratively. And so I just didn't really ever consider it. And then when it started to work and people were continuing to come back, I didn't really ever have to think any differently. Like I think if people had shown some reservations, and there will always be a few people that are like, "Oh, I want to go somewhere that takes my insurance." That's fine, but it was just working well. So I'm like, I mean, why offer it now? Everything's been going good for the past year and a half, almost 2 years.
Yeah, I mean, yeah, that's exactly right.
Yeah.
And I've had those people as well who said, "Oh, I really want to use my insurance," and it's never a goodbye. It's "I'll see you soon," because
Yeah.
we know
Yeah.
how that experience is going to work out. And I remember I had this girl once who came to me for a consultation, and she's like, "Oh, it's expensive." I'm like, "Yeah, no, I understand, but this is you're going for a different outcome here." And she goes, "Oh,
Right.
I just want to use my insurance one more time." And then almost a year to the day, almost, she comes back and she's like, "Danny, you're right."
Aw.
You're right. Uh, and like she, young girl, she all she wanted to do was like run and do like marathons and stuff like that. And we cleared it out in a matter of weeks. Meanwhile, she's tried another therapist in the interim, and I think actually even two therapists in the interim, and
Mm.
same kind of deal. Like nothing actually changed. If anything, got actually a little worse.
Yeah,
So
it's interesting also the variability of insurance plans because like she could have had a pretty good plan that gives you 20, 30 visits a year, $20 copay, pretty straightforward. And sometimes, and I have definitely seen this, there are outpatient settings where you will get pretty good care. I mean, the one that I was working in, it was just me and the clinic director and a relatively small clinic, so it's not like we could be that busy. And so there are instances where people go and use their insurance and have a pretty good experience. I just feel like with Project Physical Therapy, with Rehab with Roni, you will always have a good experience. Like it's not
yeah,
a toss up, there's no guesswork. You're going to get the same experience. You're going to have hands-on care, one-on-one, and probably have better outcomes.
definitely have better
Yeah.
outcomes.
Yeah. Yeah. Definitely.
It's no probablys in either
Yeah.
one of our
Not a
houses.
lot.
So, what good is the really good insurance plans that have 20 or 30 sessions with $20 copays if those 30 sessions don't do anything? And those copays, I'm no mathematician here, but $20 times 30 visits, like what good is it if it doesn't work? Right.
Right. Right. And that it is, yeah, I guess to my point, like it's a little bit of a gamble because you can use it and maybe you have a PT that you've always gone to and they do great work. I mean, the work that we were doing inside my corporate PT job was solid, but I was still doubled, like so
Yeah.
you're probably not going to get the same you're not going to get the same attention, but it can work for some people. And I feel like I hear this a lot in the podcast space, like the insurance model is dying, and I don't necessarily think that's the case. I think there are places for people that are appropriate to take insurance, especially like if you're post-op and you're just going in there to like get on the bike and get that knee moving and your goal is to just be walking again. I think there will always be a place for the insurance model. I just think also people are becoming a much more aware of other options that are out there.
Well, and I also think, I mean, that's true, but I think it's also very contextual to, like, again, if you are post op, I mean, almost anything that his insurance run, even if it's the worst possible insurance run thing, would already be beneficial for you.
Right.
Like, because again, you just need to move at that point.
Yes, exactly.
Like the 4 to 8 weeks, like you need to move. But for the person who's been suffering for 8 years, or the person who can't, lift their kids up, or who can't squat or deadlift without pain for the last 9 months, who's been to those places, like that's where the failures really lie. I have yet to hear of someone who comes through my doors, and at this point, I've seen thousands of people who sat down at my table and said, "Yeah, I had a good experience with my PT when I used my insurance." Well, it's
Yeah.
like, well, if you did, well, why are we here? Because clearly you're still in pain. You still got a problem to deal with, right?
Yeah.
They could be nice people, right? But if you're still struggling, we're missing something.
What are we doing? Yep. I have seen a lot of that. And I've also seen people that are like, yeah, I tried the insurance thing. My visits ran out and I just want to try it. I want to go a different route and just see what it's about. And those people always end up happy. They love what we do.
Yeah, yeah. Out of curiosity, I feel like every PT has their own unique answer to this. What do you hate treating?
What do I hate treating?
Yeah,
Oh, heel pain.
that's so funny. Why?
um, I just feel as if a lot of times it's misdiagnosed as plantar fasciitis.
Oh my
And
god.
everything's
Yeah,
right, everything's plantar fasciitis. If it's on the bottom of your foot, it's plantar fasciitis. And
automatically.
the way that people go about treating it and like all of the different methods that they've tried before they come see us tend to not work, but it tends to be it's a tough one. I'm not saying that they don't get better, but I think they take longer to get better. I mean, you are weight bearing through your feet pretty much 24/7 if you're up and moving. And it's just a bugger for me. I don't love it when I see it. I'm like, ah, here we go. But it's a good area for me to work on, and get better. What about you? What do you hate treating?
Well, hold on. Before I answer that question, is it just like heel specific, or is it like the entire foot?
Heel specific.
Heel specific. So if you get like a big toe, like you're good to
Love
go.
it. I'll take your big toe.
All right, awesome. Okay, pinky
Yeah,
toe
yeah.
as well.
Yeah. Yep, fine.
Got it. Okay, so just the heel.
Just the
Um,
heel. Wait, I'm trying to think if there's anything else. I love low back pain. I love treating shoulder. I love treating a
mhm,
hip. Hip's probably one of my favorites.
mhm.
Necks are good. I don't love a wrist.
Fair, fair.
Okay, what's your answer?
Elbow.
Elbow. Okay, see, I like elbow.
Like I'll treat it. I just
Yeah,
don't
of
like it.
course. You're not gonna turn them away.
No, well, no, unless I don't think I can help them. But
Right.
I personally don't like treating elbows because like they're both simple and complicated at the same time,
Yeah.
right? Like you said, like the heel is constantly weight bearing. Depending on the individual, like they will constantly use the elbow joint.
Yes.
Um, and it's like it's both easy but really annoying for personally for me to treat.
I feel like with elbows, it's one of two things. Either we have some irritation, either like lateral or medial epicondyle. We can do some good needling, some good exercises, loading, and they get better pretty quick, or it sticks around for a really long time
Yep,
and it's going to eventually get better on its own because the research says, I mean, some research is like, doesn't matter if you go to PT or not, it's just going to kind of like resolve over time.
yep.
Those are the ones that I'm kind of like, ah, dang, we're going to try these things, but it is occupational. Like my dad had elbow pain for forever, but he's working in a warehouse lifting boxes all day. So
Yeah.
I'm like, yeah, these things will help, but also quitting your job would help.
Right. Or some kind of other like recoping mechanism.
Right.
I had a oh, I'm starting to forget what he did. He did like multiple things. He was an electrician and he did roofing. Anyway, arms like massive forearms, but also massive amounts of pain around right in
Sure.
the lateral epicondyle. Like we cleared out the pain in like 3 weeks. Easy,
Those
easy.
are the best. I love when that
Oh
happens. They think you're
God.
a magician.
Right. They're like, what the hell just happened?
Yeah.
Easy. But then I there's another patient and she's a good friend. She's a pastry chef
Mm.
and her elbow pain was relentless. Yeah. And
Doing this.
kneading the dough, the mixing, all of that.
Yep.
And like her pain was so persistent. And it's just a matter of patience and consistency and just following the plan, not panicking. But it was like that one was real. It was really rough to treat just because it just was moving at like a quarter of a millimeter at a
I
time.
know. Tendons take time. That's a
Yeah,
tough one.
yeah.
Yeah.
Uh, but like you, I love hips. I love backs. I
I love a hip.
love shoulder. Oh gosh, shoulders are great.
Yeah, and it's funny because
Oh,
my clinic director asked me the same question when I first got hired, and I said, "I love treating ankles and I hate shoulders." And, like, it's completely flipped, I think. I think I was just afraid of shoulders because of how many muscles attach to the scapula and how much is going on and how mobile it is, but I think they're so fun. There's so much you can do with them. But that was me also actively embracing the discomfort and being like, "Okay, I need to figure this out." And
right.
then realizing I don't like foot and ankle stuff as much as I thought I did. I think I thought as a previous dancer, I would know how to treat it better, but it's not my favorite.
Well, yeah, heel pain can be tricky. I mean, I've had heel pain that was coming from the back. I've had
Yep.
heel pain coming from the toes, and yeah, it can be very complicated to treat. It's especially because, like you said, it's a weight bearing joint. Anything that's constantly has pressure on it is automatically harder to treat.
Exactly, and there's so many factors that go into it, like, what shoes are you wearing? How are you
Yep.
walking? Are you overpronating? Are you not pronating
Yep.
enough? I mean, there's just so many things, and then I will say, though, with heel pain, 2 things that I've noticed have helped just over the summer that I realized, like, don't look at their shoe wear on day 1, because sometimes
Yep.
I would wait until, like, day 3 or maybe week 2 or 3, and I'm like, "Let me check out the shoes." That is a huge low-hanging piece of fruit, and then
Mm-hmm.
secondly, if they're a runner, just changing their cadence has helped a ton with patients that just feel it on that heel strike, like, if we just change the cadence and change nothing else about their gait and running, sometimes that's the thing that changes everything. So I'm learning, you know, still young.
As we all, oh yeah, as we all are, right? As
Yeah.
we all are learning and going through. I think that just the more cases that we all see, the way I treat now versus the day one when I opened the clinic, completely different.
Oh my gosh. Same. Same. I remember
Yeah.
the first eval that was supposed to come in the doors. I was literally like saying prayers. I'm like, please don't show up. Please don't show up. Like, I don't want this is not with my clinic, but like the first job that I ever had. I was like,
Hmm.
I can't do it. And he was in elbow pain.
Did you crush it? Did you crush that
Crushed
one?
it. Yeah, yeah. He was
Let's
fine.
go.
But oh God, I did not want him to show up.
Okay. Well, I mean,
Yeah.
yeah, fair enough. Fair enough.
It's terrifying at first.
I mean, yeah. Look, when we all first start, it's
Well, Danny, not everybody had the coolest experiences and was super confident, okay?
listen, it is what it is. No, I'm kidding. I'm kidding. I'm kidding. I'm totally kidding. What would you say is a case that whether it's in your old job or with your practice now, what's a case that you'll never forget?
Oh, man.
Like you may have, I hope you never have Alzheimer's or anything like that in the future. But even if you had like any kind of memory altering condition, what's a
Sure.
case that you would remember to the end of time?
Okay. I would say this was in my previous job. There was a girl who had thoracic spine pain and she was big into pottery. So she was always bent over and mechanically I was like, this makes sense. Like this back pain's making sense. And a lot of it cleared up, but it was very cyclical and it ended up not really correlating with her activity as much as I thought it did. So I ended up telling her to go back to the doctor and they did a CT scan and she had tumors in
Wow.
her spine, yeah, and that was the majority of the source of the pain, and I was just
Wow.
so thankful that I didn't let it go that much longer, I was like it made sense at first, started to not make that much clinical sense. She didn't have any other, like, red flags. She didn't really have any other symptoms, but yeah, she ended up having to get surgery, and she's doing great.
Wow.
Yeah, kinda wild.
Yeah.
One of
Yeah.
those cases you, hear about in school, and you're like, "That'll probably never happen to me."
And then it does.
And then it does. Yeah.
Was that in your like when you worked for a clinic or with your own clinic?
Yeah, when I worked for a clinic, and I was probably about a year in, and she was my age, and I think that's why I remember it so vividly because I'm like putting myself in her shoes. Like, what if that was me? That's so crazy. She actually had discontinued PT and came back and was like, "Hey, can I talk to you on your lunch hour?" And gave show me the reports. And I was like, "Look what I'm dealing with." I was like, "This is crazy." I'm glad I didn't, keep trying to treat you and just then write it off and say you're fine. I'm glad we kept searching for answers.
You know, we talked about this a little bit in the beginning, where you asked me like, what do you find a good PT is, right? Like, how do you define a good PT? And I think that aside from clinical skill, and just like how you actually devise a treatment plan. I think what makes the difference between a PT, a good PT, and then an excellent, like world class PT is the communication aspect,
Oh, yeah.
right? So,
I
so
agree completely.
yeah, so your ability to a clinically kind of pick up on like, okay, something here isn't making sense.
Mhm.
Something here, like 1 plus 1 is not equaling 2 for some reason. Like, what's actually going on? But then your ability to communicate that to the patient, and then to continue to communicate with that same patient, it just goes to show kind of like how do you actually differentiate yourself from other providers.
Yeah, I harp on this so much, but communication is so key, and if you're not a great communicator, you can just work on it, but it is invariably the most important thing that you can do. I literally was in the clinic yesterday talking to somebody who was a PA for a spinal surgery clinic for 30 years, and she was just talking about how she didn't understand why her symptoms, like, why is it bothering me so much when I stand up and when I walk, but when I sit down it hurts. And so I was just explaining, like, what to I was thinking about what's her level of knowledge. She knows what a facet joint is. So I was talking about what's happening at the level of the facet, and then how is the spine positioned differently in standing versus sitting. And just explaining that, she stood up and she was like, I that's a really good way to explain it. I hadn't thought about it that way. And I was like, even when you have someone who you think they know everything, and she is super educated. I mean, she was a very smart woman, but she just hadn't considered how the biomechanics change with standing versus sitting in the spine, because maybe she wasn't well versed in that specific area. But the way that I was able to communicate it to her, she's like, "Oh, it was like a light bulb went off." She's like, "Yeah, yeah, that makes sense." And it made it seem less scary, I think.
Yeah, I mean, whether someone has no knowledge of the human body or someone has a lot of knowledge about the human body, like in your situation, I mean,
Mhm.
goddamn, like PA
I
for
know.
30 years in a spine clinic,
Mhm.
like that's pretty
She knows.
significant,
Yeah.
right? But it just takes that moment of understanding. Well, like from your side, right? Understanding, okay, like what does she probably know? And what's the way that we can communicate in a way that says, okay, like, hey, you know this stuff. Let me just put it in a different light,
Yeah.
right? And make the person feel at ease and like, okay, that makes sense. Cool. I'm bought in now and I understand.
Exactly, and just being able to tailor it to what you know their knowledge is, and I'm comfortable asking, like, "How much do you know about the hip?"
Yeah.
A lot, a little, like, "Do you know where your hamstrings are?" And I'm a big visual person too, so I'll pull out my app and I'll be like, especially if it's someone that I'm pretty sure wouldn't know which muscles are affected, I'm like, "Hey, look," and I highlight this and I highlight this, and they're like, "Oh, that's so cool. What is that app? I wanna download that."
Yeah. Oh my god, yes.
It's a nice little tool.
Which app are you using?
It's Essential Anatomy.
Yeah, yeah, same.
It's so
Yep.
good. It's so
Oh
detailed.
god, it's fantastic.
I want the one. Okay, have you seen the one on, I think it's Anatomy of Motion or something? It's the app that's the muscles are moving the body, like, into a squat and back out, and I'm
What?
not sure if that's an app or if it's just an Instagram account, but it is so cool. Let me pull it up. That I feel like would be even better,
Oh
but
my god, can you imagine if there was an app, it was like an essential anatomy app, but then like you say, okay, show the body doing a squat. Oh my
that's what I'm
god,
saying. It's
that is that? Yeah, is that a thing?
I don't know, I need to find out if they're an app.
Because that would be
If it's not an
incredible.
app yet, it will be soon. I mean, we're definitely we're tech forward, right? It'll be there. It'll be there soon.
That would be the next level kind of like application.
I would pay
Like,
all the money for that.
oh my god, instantly.
Yeah.
$100? Say less. Here's the card.
Yeah,
Just
I'll do it.
take my money. Take
Take
it.
my money.
Oh my gosh. Yeah, that's yeah, that would be incredible. But
Mhm.
yeah, communication. I tell my PTs all the time. I'm like, okay, look, first of all, if you can't communicate, you won't be able to treat.
Yeah.
Like it ain't happening. When we have our consultations, when we have our evaluations, if you cannot clearly portray the problem, B, understand what the person actually wants, what are their actual concerns, whether they're the ones, whether they tell you outright their concerns or the concerns that they're not telling you,
Mhm.
and you kind of have to fish out. A lot of people are very reserved and they're not comfortable sharing their inner thoughts or their inner doubts or whatever it is, and it's our job to kind of like sniff it out and address it. And like again, that's all part of the umbrella of communication, right? Understanding the psychology behind the individual who's sitting in front of us. right? Because
Yep.
they're sitting in front of us for a reason. They're not just here for fun. Nobody goes into a PT clinic for fun, no matter how fun you or I are.
I think
Right?
I've got like one every 100 patients that's just like, "Can I just come back? Can
Well,
we
fair.
just hang?"
But they
But
come back, right? After probably an
correct.
experience, right?
Yes,
Like,
after the initial encounter, yes.
yeah. But no one just randomly like, I think I'm gonna go to a physical therapist today and just hang out. All right.
Right. Yeah. I mean, picture being a patient and being just thrown through exercises and nobody explaining the why behind it. I would give up so quick, especially if I ended up sore and I didn't know why I was sore, or if the pain was temporarily worse and I wasn't sure why. I also think it helps you become a better physical therapist if you're explaining the why behind what you're doing. You're giving them your top 2 diagnosis of what you think is going on.
Yeah.
Then you're gonna get better at practicing and knowing what the hell you're doing and why you're carrying out this plan of care, and then they're gonna be more invested. And just, like, repeating that over and over so that they understand, like, this exercise is for this. This is why we're doing this. Because otherwise, you're just throwing them into a routine, and they're like, "I don't really know why I'm going. I don't know what I'm doing."
100%.
Yeah.
Were you ever a patient?
You know what? So, no, not before I was actually a physical therapist. So, all my life, knock on wood, I was real good about not getting too injured. Didn't play any contact sports. Ballet is not really contact sports, so
Hey, you contacted the floor.
yeah, true. And same with track, like I'm just running on a track. So no, I never had to go to PT until I was working and I self-diagnosed myself with a labral tear. And I was like, I can think of some things to do, but I was only like a year out. And I said, let me just go to the clinic down the street after work, same company, free treatment. And it was awesome. The guy was so good. And I was very, very thankful that I went through the process because I learned stuff about how to treat a hip labral tear and it got better. And yeah, it was a really great experience. So big fan of physical therapy.
Makes one of us.
Yeah.
I also was a patient during my I believe in my second year of PT school. I I stopped dancing to go to PT school,
Mhm.
and while there, I went through this like depressive state because I couldn't dance anymore.
Couldn't
Like,
dance it out.
yeah, well, it was my whole life. Like, it was my
Yeah.
whole identity, and now I was in in a different country with no people I know, not doing the thing that I enjoy. I actually eventually started. I think I was the first person to actually start dance classes as like an extra activity curricular thing for the school.
Love that.
Yeah, it was cool. But I went into this depressive state where I put on like 50 or 60 pounds. And at some point, I was like, okay, we got to turn this leaf around. I started weightlifting and training like heavy, like really, really hard. I was dropping like 20 pounds a month, all that good stuff.
Wow.
And at some point, I decided I was going to do a bodybuilding competition and step on stage just to check it off the bucket list, just to say that I did it. And I remember we were with my family in Canada. I was doing a bent over row, and I remember it was 135. Uh, I was doing the last rep. I was ego lifting. There were other people in the gym. I just wanted to show what a badass I was.
Uh-huh.
And all of a sudden, pop. And I was like, okay.
Disc.
hmm
Uh-huh.
So I immediately stopped. I was like, okay, let's pretend that didn't happen. We're gonna be okay. We're
Walk it
gonna be
off.
all
Walk it
right.
off.
We're gonna walk it off.
Let it absorb.
Yeah, we'll be fine. We'll be fine. The next day, we drove there, so we were driving back the next day. We
Mm.
arrived back in Brooklyn, and I realized I can't get out of the car. Like, I can't move. It's
Wow.
excruciating pain.
This is a sad story.
It is sad. Well, it taught me the process.
Yeah.
It taught me what it means to be a patient, and like I went to the top physical rehab specialist at NYU. Oh my god. I don't know where that dude's at now. I hope he's fired. I hope he quit. I hope he retired. He has no business being in the medical space at all.
No, so you had a
At
bad
all.
experience.
Burn him at the stake, you
Dude,
know?
what happened? Why?
It was horrible.
Was he like, "Now we're gonna start with the Jefferson curl"?
I mean, I would rather he did that. Like, I was a big guy. Like, I'm still, I had muscle at the time, and he looks at me and goes, have you tried seated rows? Like, get out of here. You get First of
Oh,
all, disc herniation, right? Got nerve pain going down my right. So you're telling me to do seated rows?
yeah.
Like, come on, guy. Come on.
Dude,
right? And PT
that's
experience wasn't great, and it
did you go
was
anywhere else after that, or were you like, "I'm just gonna self-treat?"
so
Like
I did. I went for acupuncture. I did PT, and then like a few weeks in, I was like, "Screw this! This is." Oh, I went to a chiropractor. I spent a couple $1,000s there.
mm,
I would limp into that office. I limped out. I was like, after a few weeks of that, I was like, "All right, I'm done. I'm done. Screw this! Like, no changes are happening. And we're gonna do it on our own." And that's what we did. So
and
again,
you got better?
yeah. Oh my god.
Yeah.
Again, this happened December, January. I stepped on stage in August,
Nice.
right? And like, granted, I would still have flare ups for about a year and a half, but that's the disc herniation journey. I mean, fast forward to today, like no restrictions, no limitations. I'm running, I'm sprinting. That bent over row is at 285, 275 overhead press, 405 squats. Like we good, we
Let's go.
good.
I like it.
But that taught me intimately the patient experience, which is why someone like yourself and myself, us pioneers, or us people who really care about our patients, I mean, we have to be loud in the space to make sure that we can help guide people towards the right direction.
Yeah, I also think for somebody, I mean, I don't know what population he was seeing at NYU, but I can imagine he saw a patient like you, heavy lifter, big dude, and was like, I don't actually think I've ever treated somebody like this. And maybe he had, and maybe he just wasn't clinically sound, but like there's also the scenario where he just genuinely doesn't know where to start with you, which is, still shame on him, because you should still understand the patient in front of you and know how to load properly, regardless of your background.
Yeah,
But yeah, maybe you were the first one he'd ever seen that was lifting heavy weights, because that is a thing.
I'd still burn them at the stake.
I'm like, let's play devil's advocate here. But yeah, no, I got you.
No love had for that kind of stuff, because like,
Yeah.
look, if you had a lifter come in and has horrendous nerve pain going down the side, like what is your kind of go to? You're probably going to establish baselines, right? Like, understand, okay, what can this person do, not do, and how can we, right? Like, what would be your process?
Right. Yes. 100. Well, and calming symptoms down first, but then like we got to figure out, like, you got this competition in August. We got to get back. We got to get to it.
Right.
Seated rows with a TheraBand probably isn't a good start.
Oh my god. Oh my god, it was
Oh, it's
terrible.
tough.
Yeah. But that's I mean, whether you see the experiences in front of you, or whether you are the experience before you have the experience of treating others, I mean, that will dictate how you treat people. Like, you, again, you started your own clinic because you wanted to have your own time, but then also to be able to have the freedom to do what you kind of deem necessary, right? That freedom freedom of time and freedom to treat, right?
Yeah, yeah. To be able to load people properly. Like, I've got the squat rack in the gym. We've got a sweet treadmill to get people actually running and sprinting and be able to do all the things. Be able to have 90 minutes for an evaluation, so we can do like a full, like, let's go head to toe. Let's not just look at the heel pain at the
Hmm.
heel. So yes, it's a lovely space. I feel very fortunate, and I'm just happy that I can keep doing it.
Okay. Yeah, I mean, absolutely. Into the future, what are your plans for the clinic? What are your plans for yourself? I know you have a beautiful, beautiful rising child growing, and
Yeah.
she's
She's a
awesome.
little
She's
cutie.
awesome.
Yeah, I think 2026 will be fun. We are expanding the space a little bit. Right now, it's like a big building, and then we've got a couple units, and we're gonna add on another unit to have just like another treatment room for my PT. So that's exciting. That's kind of big. And continuing to just work. I'm trying to put out one podcast episode a week, and that's been really fun. I again appreciate you coming on.
Of
But
course.
yeah, I think trying to get into some good clinical education classes too. I want to do more continuing ed with my PT. I just think that could be fun for us to do things together. But right now, I just want to have my one location and make it like the best location that you can find in Chattanooga. I know people assume when you start a clinic, like, oh, you're going to expand and you're going to grow and we'll be in every city. But right now, I just want to have one really good one, and then we'll just see where it goes from there.
Are there a lot of PT clinics in the area?
So many,
Okay.
so many, like on every street corner.
Yeah. Oh, wow. Okay.
Yeah,
Not just New York City.
highly saturated. It's wild. And even cash-based clinics too. I'm just off the top of my head, I can think of like 5 different ones. But I think that there are patients appropriate for every single one, and it's slightly a competition, but it's also like a community of people that are all trying to do the same type of thing. So I think that's really cool.
Yeah. Well, I mean, I have no doubt that you're going to absolutely separate yourself from the pack, in more than one way as well. So I have no doubts in that.
Thanks,
Um,
Danny.
of course,
So kind.
I'll be your hype man. I got you. I got you.
Yeah, yeah, same. I mean, Project Physical Therapy, would you ever consider another location?
We used to plan on more locations. Now, kind of running through this process. I like you. I just want to make the best damn location. Just stay with the one. Like
Right.
if something changes in the future, cool. But I just want to create like the
Yeah.
hub of quality, the hub of like this. This is the spot. And whether I'm here or not, whether it's other PTs and I'm not in the clinic at all, or I am in the whatever that situation is going to be, I just
Mhm.
want it to be the best damn spot, the place where it's going to give people encouragement and information, good quality movement, an actual solution, a path, a guidance, giving a friendly environment, just show people respect and understanding, and like I just want that.
Yes, the
That.
quality control is
Yeah.
so much more fine-tuned when there is just the one location, and it would be cool to have a satellite location maybe one day, but right now I like where it's at, and I like you like where it's at, and just keep building up the first thing and just see where it goes. It's kind of exciting.
100%.
Yeah.
100%. And I guess a final question here, because we are rounding on time. Can't believe it's been almost an hour.
I know.
Uh,
Time
cra-
flies. I mean, I'm
Crazy.
having a good time.
Same, same. But we got things to do. We got people to fix, right?
Yeah.
Oh my gosh. I want to ask one thing that tell me. Well, two things really. What is the one thing that you love about healthcare, and one thing that you want to see improve about healthcare?
Mm. Well, I'll talk about healthcare in the scope of physical therapy since that's what I know best. I would say what I love about healthcare and what we do is how well rounded we can be. I think, like we were talking about earlier, you can educate a patient on the exercises that they're doing. And that is one aspect of PT, but we can also educate them on sleeping positions, on stress management, somewhat on nutrition. We can talk to them about their imaging. We can talk to them about lifestyle and habit forming and all these other things that we know. And that I think is really cool because PT can be all encompassing. It doesn't just have to be, I go to PT to get stretched and to do my exercises. We can be really impactful in a lot of other ways that maybe other providers can't be because they don't have the time. But because we have 60, 90 minutes with these people, we have more time to make a difference. And I love that. And what I wish was different, I feel like we've touched on some already today. I wish more patients realize that they don't need physical therapy just if they're in pain or just if they're injured. Like we can be the people to go to almost for prehab or to gear up for a competition or to gear up for a marathon or something of that sort. And I think it's heading in that direction. I think at least online, more people are understanding that we can be preventative also. But I'll be excited to see in the future more patients start to seek out our services for that because we can just offer so much, we're so well rounded.
Aren't we? Aren't we
Yeah,
just the best?
we are. I love
And
us.
unbiased too. Unbiased
Yeah.
completely. Massage therapist too. Gosh. No,
But
I'm kidding. I'm kidding.
no, I do. I think that's my final answer. I'm going to clock that one in.
Okay.
Yeah.
Yeah, fair. And then I guess you have a question that you always end with, right? And maybe I'm gonna fine tune this the more of these I do.
Yeah.
What is your music of choice? Like if you had to listen to one genre of music, what would it be? And you can artists and song names too if you'd like, whatever you prefer.
Okay, I'm so the basic person that's like, I listen to everything because when I'm working out, it's a little more screamo. If I'm running, it's a little more like EDM. If I'm in the car. Okay, here, you know what? No. I would say,
Consolidate.
okay, British boy band pop music, like the 1975. That would probably be
British boy band Pop
Pop
music.
music. Yeah. Do you know
Wow.
the 1975?
British boy bands? No.
No, it's a band. You look them up.
Oh, the band? Oh,
Yeah.
1975?
I'll send you the song. That has been the one steady in my life as my music taste has changed. British boy bands, specifically the 1975, they always have my heart. So that's going to be my final answer.
You know what? I've learned something new today.
Yeah, I will send you the Spotify link. And you know what? While we're on the topic of music, really quickly, I want to start asking people this on my podcast, but I want to hear your answer. If there if there was one song that could always play whenever you walked into a room, what would your song be? Like your walkout song.
Ooh. All I do is win.
Yes. Why am I not surprised? Like yes, that tracks.
And it's right at the moment when T-Pain comes on,
Yeah.
you know, that right during that, you know, when it goes, everybody hands go up, and they say, and then it's just that's the whole part from there. That's my thing. Yeah.
And you're
Oh
kind
my
of like
gosh.
slow-mo walking in.
Oh no, I'm rambunctious.
Oh,
I'm jumping off the
cartwheeling.
rafters. I'm cartwheeling. I'm front flipping. I'm arm pumping, raising the roof. I'm going off the walls.
Okay, but I mean, I did say when you walk into a room. So this could also be like you're walking into a funeral. That's still happening?
Yep.
Okay.
If it's
A
my
it's a
funeral, if
well-rounded
I'm
song.
yeah, if it's my funeral, if I'm going to someone's funeral, that's
All I do is win. Yeah, I like that.
yeah.
That's good.
Win grievances, win win
No,
empathy.
I think that's solid. I mean, any room that you walk into, that's gonna be playing. So good luck.
I'm about to blast it through my speakers in the office, so I don't know.
Mhm.
I don't even care. What about
That
you?
or the 1970. Oh, my walk-in song?
Yeah.
It changes. I don't think I have an answer for you. Maybe Sweet Disposition by the Temper Trap, something kind of
Ooh.
easy and upbeat, but makes you feel good.
That's
Yeah.
a good one.
I know.
That's a
Look, I've thought
oh.
about this a lot. I've had more time to mull it over.
All right, so you know what? Maybe if I sleep on it, maybe my answer will change from all I do is win.
Okay. Yeah.
Uh,
Text me tomorrow. Let me know.
sounds good.
Okay, cool.
Oh my gosh, that I've never been asked that question again. You just
Yeah.
keep catching me off guard. I
Don't
love
steal
it.
it though, because I might do that one on my. I mean, you can take it. You can have it. We can both
No,
ask
no,
it on our
I'll do
podcast.
the genre bit. I'll do the genre bit.
I wasn't expecting that. Like, no one asks me about my music taste, so thank you.
So there you go. I want people to know. I think it's important.
It is.
You know,
It kind of is like a little defining because there are people that are like, I'm not really a music person, and I don't really trust those people. So,
there you go. No, but that's exactly it. Like music does tell you a lot about a person, and your choices of what music you want to listen to
yep,
when you do certain activities. I listen to music practically all day from the moment I wake up to pretty much the moment I go to sleep.
same.
Yeah,
Yeah,
and so like
sometimes before sleep.
I wonder if that's a dancer thing or not. I wonder.
You know what? Potentially, because I used to do this thing where when I would hear a new song, I would like picture what the dance would look like, and so
Yeah,
then it was like a fun thing for me to do. So yeah, that could be.
yeah.
I never thought about that, but yeah,
I used to when I was a kid. I had this like old school cassette tape things, like stereos where you put the cassette tape in there,
yeah.
and it just used to be like ballroom and Latin music, and I would dream and dance because I'd fall asleep to that, and so like I would sleep with music. Music is massive part of my life.
Yes, it's an integral part of my day for sure.
Yeah. So okay, these are good questions. Then these are deep rooted psychological questions.
Yeah, I think it's fun and it's different than PT.
Yeah, exactly.
Cool.
Giving life to PT. Um, Ronnie, thank you so much for joining the podcast episode. It's been great to have you on. It's great to have another like-minded healthcare professional here. Someone that cares about quality, that cares about their patients, that really wants to build something that people can trust, like people can go to it and trust you that you will get them from point A to point B. I think that is so important and so crucial to really have that mission in mind. Uh, money will come to a job well done, right? It's not money first and patients later. It's patients first always, and everything else that's good will come from there. And I think that again, I don't want to speak for you, but I feel like you are for the patient. you are for the patient experience and you are for the person to feel better, right? It's fair to
Yeah,
say.
100%.
There you go.
I don't I think it's silly to be like, I'm not money motivated. Everybody needs to make money to live, but it's
Sure.
not what excites me necessarily. Like, I don't
Yeah.
if I have a big month at the clinic, I'm like, "Oh, cool." Like, I don't it's just not I would rather my patients be doing super well and get that news versus like, "Oh, hey, we had a great financial month." I mean, it's cool because I get to pay my PT
Yep.
and pay myself, but I just like doing good work and getting people better. That's the name of the game, baby.
Yeah, that's why we became PTs.
Yeah.
So, and that's again why I'm so glad to have had you on the Built to Endure podcast. So thank you so much for coming on. I hope you had a good time because I absolutely did.
I had a
And
blast. Thank you so much for having me on. It's fun to be a guest every once in a while instead of always being the host, you know? I've enjoyed it.
yeah, well, good. Well, maybe we'll have you on again then. Huh? How
Okay.
about that? There we
Very
go.
cool. All right.
All right, awesome, Ronnie. Thank you so much.
Thanks for having me.